Hello, my name is Dr. Sarah Bjorkman, and this week I am going to give you the down and dirty on how to survive the first trimester of pregnancy. If this is your first time to our channel, I am a board-certified OBGYN and fertility specialist, and this is my third pregnancy. I do this channel with my husband Kurt, who is a board-certified pediatrician, and we just love to share pregnancy, birth, postpartum parenting information with all of you, as well as of our in real life experience. So let's break it down right after this. Okay, welcome back. And here we are. If you are watching this, it is very possible you have just found out you are pregnant and trying to figure out how to survive during that first trimester. I am here to help you. This is my third go round with this. And so I want you to know what to expect and how to not just survive, but maybe thrive in the first trimester. So things that always help me are knowing what to expect with things or having an idea of what might go on. If I have to do a run, knowing the course, like knowing how far my route is so much better than just for me. Then I'm going to go on a run, be back soon. So welcome to the first trimester. It is so often exciting when you get that positive pregnancy test, and with that test, you just kind of plan a whole life, and that is exciting and magical and terrifying as well. So we're here with you. We have all sorts of tips and advice and medical education about all of the topics you could think of. So please use this as a resource. And now let's go through what to expect and how to make it through the first trimester. So something that I know I found true 3 out of 3 times and patients and friends often talk about is like the profound fatigue of the first trimester. It is often super exhausting. You know, you get home from work and you can't make it through 10 minutes of a TV show, and you just fall asleep on the couch at 7 o'clock and could nap anywhere. And so this is, I mean, you're making a tiny little human. I get home from work sometimes and say, you know, I made fingernails today. What did y'all do? So in that first trimester, all the major organ systems are starting to form for baby. And that's physically exhausting. On top of some of the physical things of pregnancy that we'll talk about, it's also, again, mentally and emotionally a challenging, scary time. You know, many people are experiencing this for the first time. You don't know what to expect. You have all these fears about, what does life look like? How is this going to change my life, my relationship, my work, all of these things. And it's also so very exciting, but also there's just a lot of feelings here. So that's very normal. Process those with your person or your therapist or other friends who have had babies or are pregnant. It is a great time to start thinking about building that village to help you survive now and in the future. One of the other challenges with the early pregnancy, which is classically a time when you can feel like garbage, is also sometimes you haven't told people around you that you are pregnant. And when people decide to share they're pregnant is really variable. And there is not a right or wrong answer, but sometimes you're feeling really crummy and then nobody knows. And so you're trying to figure out how to explain why you're vomiting in the trash can at work. So there's that. On the physical side of things, and in addition to extreme fatigue, something you hear all about is this morning sickness. Morning sickness is often a lie. It can be morning, afternoon, evening, all day sickness. You never know exactly what flavor you're going to get, but up to 85% of women experience some nausea or vomiting in pregnancy. If you are in that group of people that manage to dodge this bullet, you're very lucky. Don't tell your pregnant friends because they might be puking. Things that help, like pro tips for nausea, are small frequent meals. Often your stomach doesn't like to be empty, and so having some crackers or goldfish at your bed, like to have a little snack before you get up and kind of grazing throughout the day, can often help. We have a whole video on nausea, and we're going to kind of rerun that with some updated information in the coming weeks. But the small frequent meals, often the recommendations are high protein, as well as, potentially sour candies like lemon drops. My patients right now are kind of loving these Preggy Pops. They're like these ginger lollipop sucker things. Try some of those things. If that isn't working, please keep in mind, like, you're not functioning, you're not able to drink water, you can't keep food down, you're losing weight, your life is miserable. Talk to your OBGYN, because there are pregnancy safe medications that can help with this. Like, don't want you to suffer. Of course, if you don't need to take medication during pregnancy, great. But again, we don't want to neglect mom when there are things that are safe for baby too. So don't be a hero. Yes, it sucks. Also know that usually all of this stuff starts to really improve in the second trimester. So often nausea kind of starts to kick in around that 6-week mark. It kind of peaks week 8 and 9, and then starts kind of, you're like, oh, maybe I'm feeling a little better. One little tip I have that is a little counterintuitive for both the nausea and the fatigue, that can be helpful, or that I have found for me, is to exercise. To, like, doesn't have to be a lot, but to do a 30-minute workout, get your heart rate up, lift, do some resistance training. Sometimes that gives you some more energy and also kind of keeps that nausea at bay for a little while. So think about trying that, see if it works. If it does, great, keep doing it. If it doesn't, again, sometimes in the first trimester, it's called survive. What can I eat that is going to get me through? I remember with my first pregnancy, it was like I have a can of Pringles at night. So it all kind of writes itself in the second trimester. And so that's something to keep in mind as you're going through this, is that it really usually does get better. You won't feel horrible forever. But when you are sick and tired, the days can be long and hard. So other things, patients, friends, that may surprise you in the first trimester. Your little embryo is starting to burrow into your uterus. It's got to form that connection between mom and baby. And sometimes there's some cramping associated with that. It can be kind of uncomfortable. You'll have these like random twinges of cramps and lightning crotch, and you're just like, what is going on? That can be very normal. This should not be like doubling over, stabbing, horrible pain. That is a reason to call your OBGYN, because we want to make sure your pregnancy is in the right spot. But an occasional, period-like cramp is very, very normal. Same thing that's very common in early pregnancy that really freaks people out is bleeding. About a third of women experience some bleeding in the first trimester, so it's never normal, but super common. And so common causes of that can be a subchorionic hemorrhage. We have a whole video about that. You can check out where we go into great detail about that. It can be the cervix is really, really fragile during pregnancy. There's increased blood flow, and so sometimes after intercourse, patients will have some bleeding or spotting. If this bleeding is spotting, light pink, limited amounts, that is usually fine to keep an eye on. If it is bright red heavy, like a period or more, and continues, it's something to let your OB know about. Not that you can do anything, not that you did anything, just so that, hey, you can check in, maybe do an ultrasound to see what's going on. Always, 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 something I tell my patients is, if you have a question, talk to your OB. I never want my patients worrying at home. Like, that is why you have a doctor, that is why you have a healthcare team. Send a message, whatever. Your team wants to be there for you and take care of you. Other things about the first trimester, something patients often say, like, I knew I was pregnant, my boobs were so sensitive, they're bigger. This is just one of the first things that they notice, is super common. This is because of that hormone called progesterone. It's a progestation hormone. The ovary makes it to support early pregnancy, and then around 7 or 8 weeks, the placenta really starts to take over to make that hormone. Progesterone is a little bugger because it really slows everything down. It slows down your gastric emptying. It makes that sphincter, your esophageal sphincter, looser, so you're more likely to get heartburn. It also slows down your bowels, so you are more likely to be constipated. All of these things, again, can bring some unfun physical symptoms. So I always say, get yourself some Tums for the cupboard, some Miralax. It is a gentle stool softener. It's a mush, not a push, so it doesn't make you crampy. You can put it in your favorite beverage. And it's a clear little powder. And do that to help make sure you're having regular bowel movements and not having terrible heartburn. These symptoms, again, if it's more than Miralax or your Tums are managing, talk with your OB, because again, there's some prescription medications that can help keep all this under control and keep you comfortable. On the flip side of all of this is the patients and the mamas who have no symptoms at all. They're like, well, I didn't know I was pregnant. I don't have any nausea. I feel fine. Maybe I'm a little tired, but that is its own kind of anxiety for sure. I have fallen into that with most of my pregnancies, where I really felt pretty good and was very like, is anything happening? What's going on in there? And I have felt tremendously reassured once getting to that kind of first ultrasound, where you're like, oh, hey, there's a little bean. There's a little flicker of a heartbeat. This makes me feel so much better. So the trade-off is, hey, you may be feeling okay physically, but sometimes that can be this emotional anxiety and stress that either you have no reassurance with a twinge of nausea or, a food aversion that you're pregnant. So be kind to yourself if that is you. Seek out support, as well as talking to your OB. Hey, can we do an early scan or something? And that may help you. The first trimester, another symptom from that progesterone is certainly some bloating. Often, I remember being like, this isn't a baby bump, I'm just getting wider. And so stretchy pants are one of my favorite things. I got influenced. I got some of those like super stretchy jeans that are basically sweatpants that are fun. And give yourself grace, listen to your body, and remember that this does get better. The second trimester is coming, so much so that yes, there are many days where you are sick and tired, but hey, it gets better. You even forget some of that trauma, and you're here doing it again for the third time. So you can do it. Try these little things to help you feel a little better. Take naps when you can. Lean on your people around you. It's so funny, pregnancy for the second time, when you potentially have little people, is a different challenge. Certainly, you can't just go take a nap or have just some ice cream for dinner. Like, you have other little humans that you also have to keep alive, including the one that you are making. So, there was something like potty training during pregnancy is an Olympic sport, and it certainly is. You can't just like go take a nap. So things that are helpful there are certainly, the real MVP of the first trimester was Kurt. He would, after dinner, he'd make me a coffee and take the kids outside so I could take a nap and relax. Not everybody has a partner that can be around or has a partner, and so try to find your support system, and however that looks for you, if that means, hey, you have a day off and the kid's going to daycare, great. That's great. You need to take care of you. I find these different mom Facebook groups that are local to my area where they have different play dates and meetups and things at the park. And there is something so powerful about community and going through that same experience, trauma, joy with other people. And so finding that can be really, really helpful. Again, Facebook groups, church, different things like that are places to try to find to build that support system for you, so you have encouragement and support, and even just like solidarity in this is hard but wonderful. And so here we go, mamas. And so that's my encouragement for you. This trimester too shall end. And cute baby bumps and more fun things are coming. And then there's this little bundle of joy and chaos at the end of it. So hang in there. Mamas, if you have any tips, things that surprised you, things you wish you'd known about the first trimester, please leave them in the comments below. Partners, if you have any pro tips on how to be super helpful, please leave those too. It's often a team effort here. And we will see y'all next week as we continue this journey through pregnancy.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.